Okay, for this module's laboratory interpretation clinical pearl, I'm going to go into acute phase reactants. And acute phase reactants are basically proteins that go up during an inflammatory immune response. So here we can see basic concept, basic illustration. So there's some type of inflammatory stimulus, tissue injury, infection, heat stress, muscle breakdown, psychological stress, surgery, and those tissue breakdowns of those tissue injuries release mediators that then activate macrophages and monocytes. And those mediators are also cytokines. And those cytokines then activate these immune cells, which then produce a high degree of cytokines. And then these cytokines get released by immune cells. It stimulates different proteins to be generated, many of them produced in the liver or by other immune cells. And then these acute phase reactants go up, and these acute phase reactants can then trigger the inflammatory response. So things like IL-6, TNF-alpha, they're going to cause systemic inflammatory responses throughout the body. And this could lead into fever when it activates hypothalamic pathways, or illness behavior. Illness behavior is like severe depression, no motivation, muscle breakdown patterns can happen. You see this in the elderly with just inflammatory responses, significant production of osteoclast activity and bone loss. You can get anemia of chronic disease, which is low hemoglobin hematocrit RBC with normal MCV, MCH, and MCHC from the inflammatory impact on red blood cells. And you can get changes in different minerals and hormones and things throughout the body just from the inflammatory response. So with acute phase reactants, they can be classified into either negative acute phase reactants or positive acute phase reactants. And positive acute phase reactants are things that go up during the inflammatory response, and negative acute phase reactants or acute phase proteins are things that go down. Now, ferritin is something that's also on this list, so C-reactive protein, ESR. Most of the things we measure in a clinical setting are typically positive acute phase reactants. So looking, for example, at a C-reactive protein, that's an acute phase reactant, and if it's elevated, then we know that there's an inflammatory response. And then ferritin is another acute phase reactant, and the other one that's really popular is sedimentation rate. So in routine lab work, these are the most common acute phase reactants. And the key thing to remember about acute phase reactants is that they don't all have the same effect, and they all have different physiological mechanisms that take place. So, like to give you an example, C-reactive protein levels stay up for about 6 to 8 hours. And ESR levels here, they can stay up elevated for about 8 to 10 days. And ferritin levels are going to be up for 6 to 8 hours, just like C-reactive protein. So you really have to look at these variables in one sense being different. Now, when you look at, for example, C-reactive protein, that's a completely different inflammatory mechanism than ferritin. So when you look at these inflammatory cytokines, like IL-1, IL-6, TNF-alpha, interferon, these get metabolized in the liver to an end protein called C-reactive protein. So that's really what you're measuring when you're looking at C-reactive protein. You're looking at that end product of different immunokines, different cytokines being metabolized by the liver into a protein, which is CRP. Now, you could have elevations in ferritin and have no changes in CRP. In ESR, for example, erythrocyte sedimentation rate, it's totally dependent upon having fibrinogen activity to engage. If there's no fibrinogen activity, you're not going to see the ESR level go up. So sometimes people are confused and they say, hey, I don't understand why ferritin levels are up, but CRP is normal. It's a different immune response, different immune mechanism. So inflammatory mechanisms involving iron, called the Fenton reaction, can be unique to the person's pattern, have nothing to do with the CRP level, or you might see all of them up. So don't always assume that you're going to, once you see one up, you have to see all of them up, because that's not how it works. Now, if the C-reactive protein is elevated, you know that it's happened in the last 6 to 8 hours. So it's a pretty good test to look at acute or recent changes in inflammatory responses. And the higher the number, the greater the systemic immune response. And then same with ferritin. Ferritin goes up in the past 6 to 8 hours. And for example, when you look at ferritin levels, ferritin levels, let's say outside the range, let's say 200, 300, 400 could indicate some acute inflammatory response involving iron mechanisms and free radical pathways. It doesn't tell you the cause, doesn't give you anything specific. You just know when ferritin levels are high, absolutely do not give a patient iron because it's going to promote the inflammatory cascade. And part of the reason ferritin goes up with infections is just to bind to iron so the pathogen cannot. That's one of the theories of why ferritin goes up. But ferritin can also go up unrelated to that due to oxidative stress pathways that use iron. So in either case, whether it's a free radical or infection, if ferritin levels are high, you don't want to have the patient be on supplemental iron. So that's a very important clinical pearl. It will absolutely make them more inflamed and make them worse. As a matter of fact, if ferritin levels are high, you may even want to get them off iron-rich foods. You want to get them off red meat, and red meat is really high in iron. Shellfish is really high in iron. Tofu is high in iron. Spinach is really high in iron. So you almost want to follow like a low iron diet and make sure you get the inflammation down when you see very high ferritin levels. Now, sometimes people have very high ferritin levels because, for example, they're just like diabetic and they have constant inflammation. You see that high ferritin, and you even will start to see with high ferritin levels, if they start to eat like a meal that's really high in iron, their inflammation will get worse. Like the muscle aches and muscle pains and all those things can absolutely get worse. Now, if you see ferritin levels above 1,000, like way outside the lab range, and 1,000 is a typical cutoff, you're definitely thinking about things like malignancies, and things are very, very serious. So those are some of the key differences in acute phase reactants. So the key concept is they're going to vary and they're not all the same. Now, when you look at these acute phase reactants, the ones that are positive go up like ferritin, CRP, SR. Haptoglobulin we never measure. It's just a protein released by the liver to help promote the inflammatory response with red blood cells. Complement factors like complement proteins, C2, C1, C2, C3, C4. If you measure them, you'll see them up in inflammatory patterns and infections. So those are pretty typical to see. Now, negative acute phase proteins, you typically don't measure these except on a normal routine chemistry panel. You'll have albumin there and a globin-albumin ratio. And if you see albumin levels low, the patient is sick. The patient has some serious health problems. And obviously, the lower the albumin, the more you're concerned. So if they're just like 0.1 off the lab range, don't worry about that. But if they're like 2 or 3 points below the normal reference range for albumin, you should be a little bit concerned. If albumin levels are depressed, that means the liver is dealing with such high degrees of inflammatory responses, it can't actually synthesize the protein albumin. And albumin is involved with controlling the osmotic pressure in blood vessels, so you don't have swelling and you have normal ion exchange in blood and tissues. So when you see people have liver diseases that are very significant, you can see albumin levels become really low and they get lots of tissue swelling and fluid retention because they lose that regulation of osmotic pressure. But unrelated to liver disease, when there's a significant degree of inflammation in the body, like post-surgery or severe infection, if albumin levels go down, there's a very serious inflammatory response happening, and you should be really concerned. It's definitely not a functional pattern. So that's the most common negative acute phase protein you see on routine blood work. CRP, ESR you have to order, but ferritin is typically part of an iron panel. So here's a slide that I have where it shows increased serum ferritin. And increased serum ferritin can happen when there's iron overload. And remember, you're not going to diagnose iron overload from ferritin. Ferritin is an acute phase reactant, and it also can work as a protein to bind to iron. So they call it like the storage iron protein marker. With actual iron overload, the most important marker is called iron saturation. So if you see high iron saturation, high iron, low total iron binding capacity, you have a person who's got iron overload. And that's where you see the serum ferritin. Anything outside of this is probably not iron overload. It's just an acute phase reactant. So one of the mistakes that I've seen all the time is you have practitioners that see high serum ferritin and think the patient has high iron overload. They don't have iron overload. Iron overload, you have to see these clear markers that's there. But they certainly would not benefit from taking high iron, because iron is going to promote that inflammatory reaction with iron, which is called the Fenton reaction. So acute phase reactant response. If you see ferritin high, but the iron levels are not elevated, then TIBC is not depressed, and the iron saturation is not elevated, then it's not iron overload. It's acute phase reactant that you definitely want to restrict iron, and not because of overload, but because of the inflammatory response. So other acute phase reactants that may or may not be involved could be CRP, ESR, or negative, or things that go down, like negative acute phase reactants, the most common one being albumin. So those are the key factors with acute phase reactants. Now, if you see really, really high, extremely outside the lab range of acute phase reactants, the general rule is the higher the number, the worse it is, the more severe the inflammatory response. The worst scenario is that it's not just subtle inflammation, but it's like malignancy. So extremely high ferritin above 1,000 could be a sign of that. Albumin levels dropping could be a sign of something more serious. So if you saw like a ferritin in the 1,000 range and albumin really low, that's not a person who needs functional medicine. That's a person who needs to figure out what's happening with their body and make sure they don't have malignancies. One of the things we have to face as functional medicine practitioners is, are we missing something that's there? Is this patient chronic and they just haven't been diagnosed properly? And it's not really an adrenal issue or a mitochondria issue, but they really have disease or pathology. So these are where acute phase reactants that are part of routine blood work can give you clues. Now, if you see acute phase reactants, you definitely want to look for red flags of serious illness, right? So if you see acute phase reactants elevated, it's not just some subtle inflammation, but especially if the acute phase reactants are extremely outside the lab range. The red flags for cancer: unexplained weight loss, night pain not relieved with rest, failure to improve with any treatment, history of cancer, unexplained lump, growing mole or change in appearance of mole, persistent unexplained pain, sore ulcer that does not heal after 72 weeks, unexplained bleeding, cough, urine, or stool. Those are all the typical red flags for cancer. And then, for lung disease, shortness of breath, poor physical endurance, chronic cough. These could be pulmonary cancers or just severe pulmonary diseases. Feeling full with little food, black or tarry stool. These could be signs of severe peptic ulcers or even carcinomas. Rapid onset change in speech, vision, muscle function, balance. Make sure they haven't had a recent stroke that's causing those responses. Any symptoms associated with infection, like high fever, low blood pressure, faintness of symptoms, rapid heartbeat, breathing difficulties, have to be looked at. Liver, kidney diseases. Liver disease for sure when they get progressive enough, we're going to drop albumin. But yellowish eyes, itchy skin, abdominal pain, swelling in legs or ankles, changes in urine color. Those would be indication of that. And sometimes acute phase reactions are just high because the patient's diabetic and they have lots of inflammation. So you should already know what their HbA1c and their glucose is, but these are all symptoms not symptoms, but red flags for serious illnesses. And then, one of the things that is not used to diagnose cancer is looking at different tumor markers. And the way these tumor markers work is that they're typically used once cancer is diagnosed. They measure these proteins, and if the cancer is still growing, these markers go up. Okay, so for example, if someone has ovarian cancer and the ovarian cancer is identified, they can then measure CA-125 and get their baseline level, and they can see if the CA-125 is going down or going up with treatment. If the CA-125 is going up, then there's some kind of tissue proliferation. But you should know, things like ovarian cysts that are benign could also raise CA-125. Same with like PSA. PSA is high. It can suggest they have prostate cancer, but sometimes just you have prostate swelling, for example. Now, if you see acute phase reactants high, you can use some of these tumor markers as a general screen, but they don't diagnose cancer. You kind of really think of them as they're indications for tissue growth. Now, the things you'll typically see when someone has maybe a red flag for some underlying malignancy is acute phase reactants that are high, that are persistently high. And you may or may not see weight loss. You definitely see fatigue that's unexplainable with when these acute phase reactants are up. Another thing you might see is a sudden drop of cholesterol, like that at baseline level of 220 and now it's like 110. This happened not over 2 years, but it happened in the past year, the past 6 months. The closer the drops in cholesterol markers are, the more concerned you are. Now, a lot of people have low cholesterol. That's related to other factors, but what you're looking for is that like sudden drop, let's say 50, 60, 70 points or higher of total cholesterol. That could be another red flag that you have to be aware of. So those are the key concepts of this module's clinical pearl. Understand the concepts of acute phase reactants. The most common ones are going to be C-reactive protein, ferritin, and ESR. They're not going to correlate. There's different mechanisms for each one. C-reactive protein, ferritin, 6 to 8 hours. ESR is going to be elevated for up to 10 days. Albumin levels are going to drop when there's significant impairment of protein synthesis in the liver or actual liver disease. Those are the most common acute phase proteins. The rest of them are not as common. And if you see these consistently high, and the higher the number, that indicates the worse they are. And if you see these levels high, then definitely look for red flags. And then you may even want to look at some of these tissue proliferation markers, or just refer out and have the person get the appropriate workup. That's the point of acute phase reactants. Very, very useful to understand the concept, and also very useful as a screening tool to make sure that there are no red flags or underlying patterns. Now, lots of people will have subtle increases of acute phase reactants unrelated to malignancy or any kind of serious illness, but just because of systemic inflammation. But once you see one acute phase reactant high, you want to monitor it and make sure that those levels go down. I hope this clinical pearl was useful for you, and thank you for your time.